LJones, and today I'm going to be doing a head-to-toe assessment on my volunteer Kelly. I'm a Maryville F&P student. Before we came into the room, Kelly was asked to empty her bladder, and she was offered a gown, but she opted to use just wear her tank top and shorts. We did her vital signs, we did her height and weight, calculated her BMI, which were all within normal range, and we also did the Snellen chart and the Rosenbaum chart, and on both of the charts she was registered at 20/20 vision. Also, before I entered the room, I washed my hands. So I'm just going to start with a general inspection of your head and face. So just turn your head side to side. Everything appears to be symmetrical. Her hair seems to have good and equal distribution. Eyebrows and eyelashes also with good hair distribution. I don't see any areas of balding, no rash, no redness. I'm just going to have you lean forward a little bit. I'm going to feel your head, and I'm feeling for any bumps or nodules, any areas of pain, and she doesn't appear to be in any distress. Okay, I'm going to have you look up. So now I'm just going to palpate her sinus, frontal sinus, maxillary sinus, her temporomandibular joint. Open your mouth and close. Alright, good. Okay, and all that appears to be within normal limits. I'm going to go ahead and test her for sharp and soft sensation. So this is soft and this is sharp. So I'm going to have you close your eyes. Alright, and tell me what you feel.
Sharp.
Okay.
Soft. Sharp.
Okay, good job. Alright. So, also I'm going to have you do a couple things for me. I want you to, you're going to feel kind of silly. Just clench your teeth. Okay, smile for me real big. Stick out your tongue. Puff your cheeks. Okay, and then raise your eyebrows and squint your eyes. Good job. Alright, so next I'm going to move down and take a look at your eyes. And get some of my tools over here and just set to the side. Alright, first I'm just going to inspect your eyes. Close your eyes for me. Alright, open them. Alright, eyelids look normal. Eyelashes are all look like they're evenly distributed. Have you look up here. There you go, look over here. Alright, sclera is white. Conjunctiva is nice and pink. She doesn't look like she's having any redness or swelling. I'm going to take my light. I'm going to check her pupils. So just look over my shoulder. Okay, good. Good job. Alright, and now I'm going to test your different fields of gaze. So just follow the tip of my pen light. Alright, don't move your head. Okay, good. Alright, good job. Perfect. Alright. Alright, so I'm going to go ahead and take a look in your eye. Okay. I'm going to have you lean forward a little bit. You're just going to feel me touch your eyebrow and have you look straight over my shoulder onto the wall. I'm just looking at the red reflex. And I see it there. You okay?
Mm-hmm.
Good. Alright, great job. Let you kind of recover from that for a second. Alright, so now I'm going to have you cover one of your eyes. And just look right here at my shoulder. Alright, and now uncover. Alright, good. Alright, now do the other eye. Look at this shoulder, and when you uncover, just try to focus on my shoulder. Alright. Good job. Alright, perfect. Okay, next I'm going to move on to your nose. I'm just going to basically just feel, your nose looks nice and straight, nares are symmetrical. Just going to feel. Alright, I'm going to have you breathe through your nose. I'm going to occlude one side and have you breathe in and out. Good. Okay, great. I'm going to take my light. And I'm going to have you just lean your head back just a little bit. I'm going to look in your nose. Mucosa looks nice and pink. I don't see any turbinates or any swelling, drainage. Alright, now I'm going to look at your ears. So they look symmetrical. She does have piercings on both sides. No redness, no swelling. I'm going to palpate both auricles. No pain with that. Alright. I'm going to get my otoscope ready to look inside your ear. Before I do that though, I'm going to do a couple little hearing tests. So the first one, I'm going to stand behind you, and you're going to hear me repeat a series of letters and numbers, and I just want you to repeat what you hear, okay?
Okay.
Alright.
3LT.
Okay, good. I'm going to move to this side.
R75.
Great. Alright. And I'm actually going to do the Ryan and Weber test first before I do the internal exam. So you're going to let me just place this right on the top of your scalp, and you're going to hear it vibrating. And I want you to let me know if you hear it on both sides, okay?
Okay. Yeah.
Okay. Now I'm going to have you just put your finger in one of your ears and occlude it, and then let me know which ear you hear this in best.
This one.
Okay, good job. Okay, now I'm going to test each ear by doing kind of a similar thing. I'm going to have you tell me when you stop hearing the sound,
Okay.
and then I'm going to move it around to the front of your ear, and then you're going to tell me when you stop hearing the sound, okay?
Okay. Stop. Stop.
Okay, good job. Let me do this other side.
Stop. Stop.
Okay, good job. Perfect. All right. And then last but not least, I'm going to take a look inside of your ears. So I've already got the cover on. Are you having any pain or any trouble with your ears? Okay. Just going to put this inside. All right. I don't see any redness in her ear canal. I see a pearly gray tympanic membrane. Doesn't appear to be bulging or any abnormalities. And same on this side. Ear canal looks good. And pearly gray ear. Good job. Alright. Next I'm going to take a look at your mouth. So I'm looking at your lips. Lips look pink. They don't look cracked. Open your mouth for me. Oral cavity looks nice and moist. I don't see any dryness. I'm going to take a look at your teeth. Teeth are ivory. They appear nice and straight, clean. I don't see any obvious caries. Alright, I'm just going to be putting this in your mouth and moving your tongue around. So kind of try to move your tongue over to your left side for me. Good job. Open wide. Okay. Nice pink mucosa. Looking under the tongue. To the other side, please. There you go. Alright, everything looks good. I'm going to look at your palate. I don't see any malformations. I don't see any areas of blackness or any sores. Now I'm going to look in the back of your mouth. Open your mouth wide and say, ah.
Ah.
Okay, good. Tonsils look normal. Uvula is midline. I'm going to elicit a gag reflex. Okay. Here, gag. Yeah, okay, I can't tell. Alright, sorry. Okay, I'm not done looking in your throat.
Oh.
Alright, sorry. And I don't see any drainage in the back of the oral pharynx. Okay, perfect. Sorry about that. You have a slight gag. Okay. So now I'm going to have you shrug your shoulders for me. Good. Okay. I'm going to be looking at your neck, so I don't see any swelling. I don't see any pulsations. No. Her trachea appears to be midline, just on appearance. Have you turn your head from left to right. Good job. Okay. And then I'm going to have you just do like this. Alright, then I'm going to have you turn it left to right and try to go against my hand. Okay, good. Good job. Okay. Now I'm just going to start palpating and seeing if I can feel any swelling or feel around the thyroid area. Trachea feels normal. Alright, I'm going to palpate for a carotid pulse. One side at a time. Alright, and I'm going to go ahead and check her lymph nodes. So I'm going to be feeling pre-auricular and post-auricular, occipital, and then tonsillar, submandibular, and submental, and posterior cervical, anterior cervical, and supracervical. Alright, and I don't feel any lymph node swelling at all. I'm not having any sore throat or any pain. Okay. Alright, I'm going to raise the, if I can, raise the head of this up. Maybe. Maybe not. Okay, but at this time I would have Kelly lay back at a 45-degree angle and see if I could see a JVD distension. So, and I suspect that I cannot. So, I'm going to go ahead and move ahead, and I'm going to take a look at your arms real quick while I'm already in this general area. So I'm just going to be feeling down your arms. Everything feels normal. Capillary refill is less than 2. No cyanosis. Nail beds appear to be within normal limits. No clubbing, no chipping. I'm going to go ahead and just check your brachial pulse. Alright, I'm going to check a radial pulse. Okay, and I'm checking your lymph nodes. And I'm going to check your axillary lymph nodes. I'm doing it on both sides, sorry. Go ahead and move to the other side. Okay, no abnormalities. Same on this side. Capillary refill is good. Brachial and radial pulses are within normal limits. Fingernails look same as the other side, so everything looks good there. Okay. I'm going to move around to your back, actually. So some of the times I might have you lean forward just a little bit, just so I can get a better feel of what's going on. At this time, I'm probably going to ask you to, I'm going to pull your shirt up back here. You don't have to take it off if you don't want to. Alright, so I'm just going to be inspecting her back and watching her breathe for a second, just to get a good idea if she has symmetrical breaths, good rise and fall, any work of breathing, and I don't see anything abnormal. It looks like she's breathing at a normal rate, so I'm just going to put my hands on her and just be feeling her breathe. Normal expansion. Okay, so right now I'm going to just go ahead and test tactile firmness. So, Kelly, every time I touch your back, I want you to say the phrase 99, okay?
Okay.
Alright, here we go.
99, 99, 99, 99.
Alright, good job. So it's equal on both sides. And then I'm going to go ahead and just percuss, okay? So you're going to feel me just tapping on your bunch. Just breathe normal. And compare sides. ahead and check for diaphragmatic excursion. So I'm going to have you lean forward just a little bit, just for me. And then I'm going to have you blow out and take a deep breath and then hold it, okay?
Mm-hmm.
All right, on my count of 3. 1, 2, 3. Deep breath in and hold it. In. There you go. Okay, you can let out. And I'm just going to mark right here. All right, now I'm going to have you take a deep breath in and then blow it out and hold it out. Okay? On my count of 3. 1, 2, 3. All right, perfect. You can breathe. All right, and that looks to be within normal of 3 to 5. All right, and now I'm going to get my stethoscope and I'm going to listen to your back, listen to your breathe. All right, take a deep breath. Good job. I'm going to have you say the phrase 99 a few times. So every time you feel me touch, I'm going to have you say it again, okay? Here we go.
99, 99, 99, 99, 99, 99.
Okay, good. I want you to whisper 1, 2, 3 every time I touch you, okay?
Okay.
Here we go.
1, 2, 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. And last one, sorry. I'm going to have you say the sound E, like 2 E's together, okay?
Okay.
Here we go.
E, 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 E.
All right. Great job. Lungs are clear. I don't hear any crackles or bronchi. I don't hear anything abnormal at all, so everything looks to be normal. I'm going to go ahead and move around to the front of your chest and kind of do some of the same stuff. First, I'm just going to inspect and watch it breathe. Take a few deep breaths, let them out. Okay, good. Looks symmetrical. She doesn't look to be having any work of breathing. I don't see any retractions. I'm going to put my hands just on your chest and feel, you take a deep breath. Okay, I don't feel any rubs. I'm going to put my hands down here. Okay, good expansion. It's totally symmetrical and normal. All right, perfect. All right. Now I'm going to go ahead and just kind of do all the tapping stuff that I was doing on your back. I'm going to do it on the front, okay? So, just pretty normal. Okay, good job. Alright, and everything sounds normal. I'm going to do just the same thing I did with just 2 times with the 99. Okay, so here we go.
99, 99.
Alright, good job. Alright, now I'm going to listen to the front of her chest. Okay, I'm going to move below your shirt. Okay. Alright, good. Everything sounds totally clear. Lungs are symmetrical. I don't hear any bronchi or crackles or wheezes. Actually, I'm going to go ahead and put my stethoscope back on. I'm going to listen to your heart sounds while I'm already on the front of your chest. So, you just relax. I'm going to listen to the atrial. Pulmonic. Okay. Erg's point. Tricuspid. And mitral. Alright, good job. I think we're going to move on to your abdomen. So if you want to just lay back for me, I'm going to come stand over here on your side, see if I need anything. Take this.
Oh, that's my bad.
Your back. Yeah. Alright. So I'm going to have you go ahead and pull your tank top up and just lay it over the top of your bra. So first thing for the abdomen, I'm just going to do a general inspection. Abdomen is flat. I don't see any pulsations, any lumps or growths. The skin looks normal, healthy. I don't see any scar tissue. I don't see hair distribution, normal distribution of hair. Muscle mass is within normal limits. So everything appears to be totally within normal limits. So next I'm going to listen in all 4 quadrants. Okay, she's got good normal bowel sounds. And I'm going to go ahead and listen to your arteries. So I'm going to listen to your aortic artery. Listen to the renal arteries. Alright, iliac arteries. And the femoral. Alright, everything sounds great. So I'm going to be doing the similar tapping that I was doing on your back. I'm just going to do it on your belly right now. So go ahead and percuss. Okay, normal tone. I'm going to check her liver borders if I can. So I'm going to percuss all the way up. Going to mark a little mark here, and then I'm going to attempt to come down the side. Okay, perfect, and that looks to be less than within normal limits. I'm going to percuss over here by your spleen. See if I can hear an area of dullness. Appears to be right here below the rib. Alright, so now I'm going to just do some pushing on your stomach and just let me know if at any point it gets uncomfortable.
Okay.
Alright, so first I'm just going to start with some light pressing. Feeling over the area of the bladder and the stomach. Okay. Alright, and it's going to get a little bit more deep. Okay, normal musculature, I don't feel any bulges, I don't feel anything abnormal. Okay, so this is kind of my deep palpation. Now I'm going to have you take a deep breath in. Let's see if I can feel that. Remember, I can kind of feel the bottom of it. Okay, that's fine, you can relax. Great. Alright, while you're laying here, I'm just going to take a look at your legs. Legs appears to be nice and normal. Musculature is normal. I don't see any scar tissue. Hair distribution is even. Skin looks nice and warm, pink, moist. I don't see any areas of no injuries, no dryness. I'm going to take your shoes off. I should have done that before we started. Sorry.
You got it?
Just so I can look at your feet and feel your pulses. Alright. Alright, same thing with the feet. Capillary refill is nice and normal. It's less than 2 seconds. I'm going to feel pulses, so I'm going to feel the distal dorsalis pedis. And feel the posterior tibial. Alright, and check popliteal. Alright, check the other side. Alright, good job. I'm going to have you sit up again, and I'm going to check your reflexes real quick. Have you just hold your arm out, hold your arm, and you just let it relax. See if I can elicit a reflex here. Okay. Relax. Okay, good job. And now I'm going to do your knees. Good. Okay, and check your Achilles. Okay. Alright, great job. I'm going to set all this stuff down over here. Alright, and one more last thing, to have you lay on your back and roll over to your right side, and I'm going to just check your spine and your neck. So I'm just going to be feeling up your back, just feeling for normal spinal process. Okay, that feels all normal. Any pain anywhere?
No.
Okay. Neck, cervical, spine feels normal, feels in line. I don't feel any major step-offs or anything obvious. Let me sit back up. Thank you. I'm going to listen to your neck real quick. I think I forgot to do that earlier. And just listen for carotid bruit. Okay. And listen over the thyroid area. Okay, that sounds normal. Alright, Kelly, I think we are